session today.
Thank you. First and foremost, I acknowledge to the traditional custodians of the lands upon which we, myself and our guests, record today's forum. I extend respect and gratitude to the elders past, present and emerging of those nations, and to all Aboriginal peoples listening and watching today. Always was, always will be. Thank you, everyone.
Thank you so much. So welcome everyone, and thank you, Timberlina. Thanks for joining us for today's regional COVID-19 forum. My name is Maeve Marsden. I'll be hosting today's session. I'm based in Sydney, where I live and generally work on Gadigal land, but I program a national LGBTQI+ storytelling project called Queer Stories, which has also travelled to regional areas and around the country. So perhaps some of you are from towns where I've popped on in. I'm honoured to be part of today. We hosted a similar forum a few weeks ago and I learned so much myself. Honestly, I don't know if it was weeks ago or months ago at this point. I've lost all track of normal time. Who knows? At some point in 2020, we had a really interesting forum. But yeah, I'm really looking forward to today's. Yeah, look, this is more social contact than I've had in days. So let's hope I can remember how to talk to you all. A little housekeeping. We'll hear from some wonderful guests today and I'll be posing questions to them from the community that have been submitted in advance. You're also welcome to post questions in the live chat to the side. Please don't turn on your video and interrupt us, just post into the chat and we'll be monitoring that so that we can gather those questions, and where there's time, we'll be able to pose them to the guests. The forum will be recorded and made available for viewing online, but please be assured we won't include your personal video, keep it off, and it can't be seen by others if you do that. They won't be recorded, and the live chat comments also won't be included in that recording. We want this forum to be a really safe and supportive place for participants and panelists. So please, while we discuss all these topics, some of them are difficult and complicated, but keep any requestions. That's good. This is a good sign of my speaking capabilities today. That's a good word though, requestions. I'm going to stop. Keep any questions respectful. Please keep them respectful and consider the needs of everybody else who is responding to and reading the chat. If any of the topics discussed today cause you distress, the suicide callback service can be reached on 1300 659 467. Lifeline is 13 11 14. And the number for Q Life is 1800 184 527. We're going to post those numbers because I don't expect you to have a notepad. We're going to post those numbers in the Zoom chat and you can also look them up online. Remember that if someone you love is feeling distress, you can also call those numbers for guidance, even if it's not you personally. So let's get to it. We'll be discussing the health implications of COVID-19, as well as some of the other issues that the pandemic and lockdown causes for LGBTQ people. But we'll kick things off. I'd like to invite Sarah Lambert to say a few words. Sarah is the Director of Community Health and Regional Services at ACON.
Passed the first test and I've unmuted myself. Hello and welcome. It's so wonderful that we're having a regional forum. As Maeve said, we had a statewide one a few weeks ago, but we know that regional areas, we have unique needs and experiences, and a lot of the discussion and the information you will have been receiving will be mainstream and will have come from, I guess, more city-based or metro-based sources. So I think it's a really great opportunity for all of us to talk a little bit more around where we are and where we work and live. And I'd like to echo Timberlina's acknowledgements of the lands that we're all meeting on. I myself at the moment are in Parramatta, so still on the outskirts of Sydney, and I've just done a Google to find out which land I am because I get a little bit, it's the Darug Nations. Thank you. I hold them all in my head, but sometimes I get a little bit confused. I apologise for that. I'd really like to also acknowledge our wonderful speakers. Thank you so much for giving up your time. Our speakers are from across regional New South Wales, and it was really important that we did have regional representation for this forum. So they're speaking directly to the experiences of our communities and what we're seeing. And I'll just start by telling you a little bit about ACON at the moment and what our operations are, given that things have changed for all of us. So first, ACON continues to be here for help. We continue to deliver services. We're available by phone and online for any of our client services, be it counselling, care coordination, substance support counselling or peer work. And our offices in Lismore and the Hunter remain open. That includes our needle syringe programs, and they are open Monday, Wednesdays, Fridays between 10 and 2 p.m. We've unfortunately needed to reduce the hours so that we're keeping yourselves and our staff safe, but please keep in mind that we are open and accessible. You can also access a great suite of resources that we've developed in response to COVID for our communities. While we have the same needs and same issues often as the general public, sometimes it's a little bit different or a little bit nuanced. So we have a suite of resources on our sexual health and wellbeing, including sexual health at this time within casual sex. We also have resources around drug and alcohol, domestic and family violence, mental health, and I'm sure there's others that I have missed there. So please have a look at the ACON website. It's acon.org/what-are-we-here-for/COVID-19, and Gav will have that up on our details, but you'll find all those resources there. I'd really like to emphasise there's no change in the support or the quality of services that you receive. It's really great because we're actually, by going online, it's actually forcing us to perhaps do things a little bit differently, and ACON's invested in our technology, which means going forward there's some exciting possibilities. And we're very much going to advocate to the government that telehealth access remains under the Medicare items, because we see it as a real equity issue across regional New South Wales. And while sometimes the internet and technology can certainly be barriers, we feel that where we can, it's really impossible those options are available to people. And in fact, we've actually been seeing people who may have otherwise not come forward for support at this time. So we know that that is actually something that is of interest for our communities. We've had clients who are already with us, and our staff adapt pretty well to the technology, and we'll certainly be there to support anyone who wishes to engage with us and walk you through how to use it if you're not familiar. Though the fact you all got on Zoom means we're in a really good place and a good start. So lastly, I guess what I would say from ACON is, if there's anything that we're taking away, particularly as a silver lining, is the use of the technology, and that we're all getting a little bit more comfortable with it and becoming more tech savvy. And so with ACON's investment in the technology, it's opening up our ways of working. And while we have brilliant workers who come and visit the many towns in which you all live, and we will very much continue to do that, and as soon as it's safe for everyone and the restrictions are lifted by the government, we'll be doing that. It does open up opportunities for us to do a lot more things online, including peer webinars, workshops, meetings, etc. So exciting times ahead in that regard, and at the moment really we wish that everyone is staying safe and well, and we are going to engage in a discussion around how do we best support ourselves and one another at this time. I won't delve into that because we're going to have a great range of experts to talk about that, but thank you for coming on board, and ACON will continue to post things within the discussion and following, including follow-up for anyone who's registered with some of the details of the services we're speaking to. Thanks everyone.
Thanks so much, Sarah. It's great to see as well in the chat people starting to post where they're zooming in from, so that's nice. And if you haven't already, it's good for us to get a sense both how many of you are working for similar organisations and how many are community members, so it's really great to read. Next up, welcome Dr. Kat Taylor, a public health physician at Hunter New England Population Health. Kat's going to be providing an overview of the current COVID-19 epidemiology, both globally and more specifically here in New South Wales. Kat.
Thanks very much, Maeve, and thanks everyone, and thanks to ACON for the opportunity to come here and speak with all of you lovely people from here in Newcastle on beautiful Awabakal country where I'm based. I'm just going to, we've just been speaking about how smoothly the technology's been working, but I might also just try and share my screen. Sorry, Gav, I've lost the ability to do that.
Sorry, Kat, just give us 1 sec.
No problem. Okay, so here on, oh.
We may have lost Kat.
No. Here we go. We lost you there for a second.
Hello.
Kat.
Oh dear. Hello, Gavin?
You're back now, Kat. Do you want to try sharing that screen again?
Hi, can you hear me?
We can hear you. We just the screen sharing didn't quite seem to work.
Oh dear. I'll give it one more go and then we might have to just fly blind.
That's working for me here.
Excellent. You can see COVID-19,
Yep,
the dance.
that main.
Yep, that's working.
Fantastic.
Wonderful.
Thanks everyone for your patience. All right. So look, I've just been asked to give you a bit of an overview of what's going on from a public health perspective about the COVID-19 cases globally in New South Wales and also regionally, and what that might mean for our regional and rural areas. And I've called this one the dance for reasons which will become apparent later. Unfortunately, it's not the kind of dancing that we'd all like to be doing, but it's about dancing with the virus. So has that worked for the next slide? Beautiful. So I won't dwell too long on this. We all realise that these are pretty extraordinary times that we're in. I would say there's been unprecedented use of the word unprecedented, but you can see here that, you know, there have been over 4.2 million confirmed cases of COVID-19 globally and, you know, 290,000 deaths, which is quite staggering. And I was just thinking to myself, it's incredible that we're, you know, now sort of rounding to the nearest 100,000 when you think that each and every one of these cases is actually somebody's mother or daughter or father or son or partner or friend. So, I mean, this is truly a once in a lifetime emergency and we're navigating into uncertain times. We don't know how long this is going to last. We don't know when a vaccine is going to be available. There are a lot of things we don't know in terms of, you know, other questions about whether people have lasting immunity once they're infected and a lot of other questions. But there are some things that we do know, and our knowledge is growing every day. So the first thing that we know is that this virus is predominantly a respiratory disease. So these are some of the symptoms of COVID-19. The common symptoms include fever, cough, shortness of breath. Less commonly, things like diarrhea, muscle aches, headache, and an interesting one that's come up a bit is unexplained loss of your sense of taste or smell. We also know that the virus can be serious. So we know that probably around 80% of people will have either mild to moderate symptoms or possibly even no symptoms. They may not even realise that they've had the virus. But in around 15-20% of cases, it can be quite severe. A number of those people will need hospitalisation. And in a proportion of those people, they'll go on to need intensive care. And unfortunately, around half of those that require that intensive level of care may progress to die, unfortunately. So we do know it can be a serious condition. And we also know that COVID-19 is quite contagious. So on average, if left to their own devices, each person that contracts COVID-19 will go on to infect 2 to 3 others. So how is it spread? We know that it's spread predominantly through what we call droplets. And this is a lovely picture of a sneeze. You can see from the scale on the bottom of the screen that these droplets are basically emitted anytime we talk, laugh, cough, sneeze, sing, and that in the example of a sneeze, they can actually travel quite far distances in the air. So this is 110 centimetres or just over a metre, which is why you've had a lot of discussion coming in around physical distancing, around 1.5 metres or 2 arms lengths of staying away from one another, and also 4 square metre rules indoors. So it's all based on the distance that these droplets can spread. And then also to a lesser extent, these droplets can land on surfaces and while they're containing virus can be picked up by people touching those surfaces and then going on to touch their faces or mouths, as we all do many times, often several times a minute, and unwittingly infecting themselves that way. So we know that transmission is quite easy for a virus like this. And we also know that it's quite difficult to control in an environment such as a cruise ship, or a music festival or a pub or a club. So I guess the next question is, how do we stop the spread of this virus? I've just put up here a summary of the key disease control strategies that we use in general for communicable diseases. So you have your basic infection prevention and control, and that relates to things like basic attention to hand washing, covering up, wearing masks and gloves, those sorts of things to prevent people from coming into contact with the virus. The second point here is isolation, which relates to people who actually have the disease or the virus, keeping those people away from anybody else so that they can't pass that virus on to others. The next one is quarantine, and sometimes isolation and quarantine are used interchangeably, but there's a subtle difference. Quarantine is actually the next level out of ring fencing the virus. So once you've picked up somebody that has COVID-19, it's about identifying all the people that that person has been in close contact with and asking those people to stay away from other people so that if, they may be actually harboring the virus, but not yet know it, and they may go on to develop the virus. So it's about keeping them away from others, so you're preventing that next generation of virus transmission. So that's what quarantine is about, and that's also what's being applied to travellers who are coming back from overseas, for example. The idea behind treatment, the next point, we'd love to have a treatment, not only because it would help people to get better quicker,
It's not just me. Has Kat dropped
No,
out?
Oh,
yeah.
hello.
Kat,
Oh, there
have we
she
got
is.
Kat there?
Yes, I'm getting black screens of death though.
Yeah, it might be worth just doing audio for a little while and just talking us through it. I think that might be the safest bet.
Sorry, my screens are going in and out, so I'll just try and close some things and see if that helps. Can you still hear me though?
We can hear you. So I think probably at this stage it would be best, because you can always share the slides with participants afterwards. So I think at this stage, perhaps if you can just focus on the spoken side of the presentation, just so that we don't lose you again.
Yes, no problem. Okay, well, hopefully you can still hear me. As I said, we'd love to have a treatment, and obviously that's of benefit to the person, but the idea is that if you can successfully treat someone, you can prevent them from being infectious to others sooner as well, rather than having to wait for them to fight it off naturally. Oh, hello?
Yep.
Sorry, my screens are still cutting in and out. Yes, but as yet, no effective treatments have been found for coronavirus 19, although a lot of treatments are currently under trial. And then, of course, we'd all love to get to the stage of a vaccine, which is where you can prevent people from becoming sick in the first place by essentially priming their immune system to be able to fight off the disease without them having to get sick with it first. So there are a lot of the strategies. Oh, I'm so sorry, my computer's going nuts. There's some of the strategies that we look at in terms of controlling this, and in the absence of a treatment and vaccination, we're really relying heavily on those basic public health measures of hand washing, keeping sick people away from other people, and really getting on top of and identifying any cases that might be in the community, and keeping them away from others, and also their close contacts away from others. So my next slide was going to be about how are we doing in Australia. And you would see that we've actually, we're in quite an enviable position, which I'm sure a lot of the people around the audience would be aware of. Around mid to late March, we started to see a really sharp rise in cases. And the whole idea is that with a virus that spreads, to 2 to 3 extra people from each infection that you get, it's going to take off very quickly if you don't put anything in place. And so we did start to see this very sharp upslope in cases coming in around mid-March. But then, in quick succession, a lot of restrictions were put in both on international borders, so restricting people's movements into Australia, so stopping importation of the virus, and then also on people's movements within Australia. So I don't need to go through this in detail. We've all been living it for the last couple of months, but those restrictions on social distancing, on mass gatherings, cancelling festivals, closing venues, etc., all of that stuff that has been so devastating to what we have previously taken for granted as our way of life, has actually all been extremely effective in controlling the rise of new cases of this virus. The next slide was one called The Hammer and the Dance, and it basically demonstrates that, you know, we've gone in really hard with all of these measures now, and, you know, all these conversations come in around so-called flattening the curve. But the question then is, you know, how long will these lockdowns need to continue for? How long will we need to be under the shadow of coronavirus for? And the idea is that, you know, once you've put in these really aggressive early containment measures, you then enter into a period of dancing with the virus where until we have a vaccine that will reliably protect the population against the virus, we're going to need to have a balance between easing off on restrictions and also seeing that rise in cases. So as we ease off restrictions, we do expect to see some increase in circulation of the virus. We're still not in a position where there are no local clusters within Australia. We know that there's still clusters, particularly in Victoria. Most recently in association with McDonald's, unfortunately. And we know that there are, you know, pockets within society that may be more vulnerable to this virus circulating undetected. So we're now in that phase where we're really trying to cast the net wide. We're trying to find any cases that might be hiding out there in the community. As we've said, this can be a mild disease that just mimics a cold. And we're only really going to know if those people get tested for COVID-19. Okay, my next slide I think was about considerations for regional and rural areas. And obviously we live in a wonderful wide brown country, and the distances can bring their own set of unique challenges with them. I don't need to tell this audience about what we're facing every day, but essentially it does come down a lot to access. And so access to testing was an issue very early on, but a lot of work has been done in that space. And I'm very happy to tell the group that the Tamworth local government area actually is at the top of the leaderboard with respect to the number of tests that it's doing as a rate per population within the whole Hunter New England local health district. So that's a great success story, but of course there are, you know, other places. So Gunnedah, which is still within the Peel sector, unfortunately has the lowest rates of testing. So there is, even though we're doing very well as a country with respect to testing, and also as a state in New South Wales and as a district, there are still pockets, and those pockets tend to be in rural and regional areas where there does appear to be under testing. Another consideration within rural and regional areas is obviously the huge mental and social impacts of some of these draconian social distancing measures. Obviously technology is great when it works. Technology tends to work less reliably in rural and regional areas, and people may not have as effective access. They might not have good reception. They might not have access to reliable internet, etc. And so a lot of the remedies to the isolation that's felt from social distancing measures so a lot of that's offset by technology, but there may be barriers to accessing technology in rural areas. We've also found that communities and living in a small town, while it can be a two-edged sword. So while communities can be incredibly supportive and really band around one another and get each other through crises like this, we have also encountered on the flip side that, you know, news travels fast, and sometimes people who are diagnosed with COVID-19 or who are under quarantine for COVID-19 might experience ostracization and marginalization. And obviously that's even more of a consideration in our communities here. In a rural setting, obviously there are questions in terms of health service capacity. And I'm not an expert on health service capacity, but I am part of some of the meetings where I know that the local health district is doing a lot of amazing work in really trying to build that surge capacity, and also trying to set up the systems to ensure that there's equity of access to the right care at the right time in the right place for people in Hunter New England. And then finally, there are also unique issues that face our First Nations communities, but I'm also really proud to to report that I'm aware of some great work that's happening in the space that's being led by First Nations people, both within Hunter New England Local Health District, but also the community controlled health sector, in terms of developing cultural governance models for managing COVID-19, in terms of managing COVID-19 in cross-border communities, in small remote communities. So there's a lot of work happening in that space. And so I'm pleased to report that it seems like hopefully we are learning slowly, but have learned from previous pandemics such as the influenza A H1N1 in 2009, where unfortunately, although Aboriginal and Torres Strait Islander communities were disproportionately affected, they weren't really brought to the table or included in any of the plans and policies around that. So there's been a lot of progress in that space. And I'm sure there's a lot more issues within regional and rural communities, but I know that there's also a lot of strength within those communities to tackle some of those issues. As I said, I'm flying completely blind, so I don't have my last slide, but I think it was something about, what can I do now? And I suppose my advice is we're at a bit of a crossroads. So we have successfully flattened the curve in Australia and in New South Wales, but we're now entering into that uncertain phase, which is known as the dance, where we are kind of moving between, getting back to life as normal, but also trying to keep this virus contained to a level where our health services can manage it and where we can stop the cases from going up exponentially. And so I'd advise all of you out of there to, I know it's hard, but to please try and maintain those social distancing, pay close attention to, hygiene, cleaning down surfaces, paying attention to how often you touch your face, whatever strategies you've come up with to, try and minimize transmission, please try to focus on those. The next thing is really, if you do have any symptoms, then please get tested. So we really want to try and test to pick up any virus that might still be circulating in the community and to really ring fence it so that we can snuff it out. And lastly, I don't think I need to tell this audience, but please reach out. So firstly, if you're struggling yourself, please, reach out to any of the great services that have been mentioned previously on this session. But also, think about each other, and the level of community support in this pandemic has been quite overwhelming. We owe these successes in Australia really to your actions as community. And so, please continue to reach out for each other, call in on each other, check on your elderly relatives, and keep up the great work. Thanks, everyone.
Thanks so much, Kat. Next up, I'm going to invite Dr. David Smith to have a chat with you. David is the Medical Director of HIV and Sexual Health Services for the North Coast of New South Wales, and he'll be focusing on the relationship between COVID-19 and sexual health and how that impacts our communities. David.
Thank you, Maeve. So I'm in Lismore, and this is on the Bundjalung country. I guess it's a rather difficult subject because if anything is, as far as close contact goes, it's sexual contact with people. I would prefer, there's been a lot of talk about social distancing. I would prefer to call it physical distancing because I think we can still remain socially connected. And it's unfortunate that that terminology started off as social distancing. So it's unfortunate that physical distancing is inconsistent with sexual contact. However, sexual contact is not the only form of sexual pleasure that we can derive from, derive pleasure from. And so there's a great site, I know this is spoken about on the ACON website, looking at measures such as masturbation, toys, apps to connect with people, and there are numerous types of apps. We can employ phone sex, and we can also employ video sex. Although I haven't seen much discussion about what's going to happen when someone's phone, where their conversation is recorded, or their video links are recorded. I'd be interested in hearing some other comments on that. So looking at the populations that are higher at risk, I'm sure we've all heard about this ad nauseum, and but I'd like to sort of go over it. Those at a higher risk of a poor outcome with COVID-19, which is opposed to being more likely to become infected, are those that are older, and so with each decade of age goes an increased risk of a poorer outcome. Older people with comorbidities are particularly at risk, and those comorbidities are quite broad. Heart disease, lung disease, diabetes, high blood pressure, kidney disease, obesity, and smoking is a particular risk for people. The damaged lungs find it very much harder to cope with the onset of the viral pathogen in the lungs. Also those who are immunosuppressed, and this touches on those who are HIV positive. When they refer to immunosuppression, they're really referring to people who are on cancer treatments, who are having transplant treatments, rejection drugs, and those who might be on immunotherapies associated with autoimmune disease. For HIV, it really refers to those who are not on treatment and those whose CD4 might be less than 200. HIV and COVID, what's happened there? There's little published data on this information. Was a Chinese case that was first published early on of a male who was diagnosed with late HIV infection and COVID at the same time. He had advanced disease, but was able to survive this and also clear the COVID or the SARS-CoV-2 virus. And then there's another study of 5 patients from Italy. 4 of those were on HIV treatment and with reasonable CD4s. The 5th person was, like the Chinese one, a new diagnosis with late infection, and that person had concurrent pneumocystis pneumonia. 2 of them, including the late HIV diagnosis, was admitted to intensive care and needed ventilating. One was invasive ventilation and one wasn't. Interestingly, 4 of those 5, including the new HIV diagnosis, eventually recovered, and the 5th person at the time of the publication was still in ICU, hadn't actually died. So I think that's fairly good news for those with HIV. It really appears that someone on treatment with a reasonable CD4 is not going to have a problem with COVID more than others. It's probably other comorbidities that would be a problem. So that brings us then to HIV and antiretrovirals. I know there's been a lot of talk about that. One of the older HIV treatments called Kaletra, which is a protease inhibitor. It's actually a combination of 2 protease inhibitors. Was shown to have some benefit in MERS, or the Middle Eastern Respiratory Syndrome. An early trial that was published out of China with low numbers, about 40 was a control trial, so there were 40 using the Kaletra and 40 not using the Kaletra, really showed little benefit from the drug. And that's thought probably due to the shape of the protease enzyme that SARS-CoV-2 has, and that the drug doesn't really fit into the inhibiting pocket. None of the other HIV drugs have been shown to be of any benefit whatsoever. In the laboratory, that is. They haven't really been trialled because they have got past laboratory testing. So that really brings us to PrEP, because PrEP is the use of HIV antivirals, known as the nucleoside analogues. We all know about PrEP. it has no benefit in preventing HIV infection. So it's important that that word gets out. I know there was certainly, it probably is now, but at the early stages there was a lot of talk about maybe the HIV treatments or PrEP would prevent people from becoming infected. So STIs and COVID. One would think if we're physically distancing, that it's unlikely that sexual transmission of an infection is going to occur. So my suggestion to sexual health suggestion is that it's, if you haven't been had an STI test that covers the period before social physical distancing commenced, it's probably worth seeking that screening to see if you've got anything. And then physical distancing should mean that we decrease the number of STIs that are in the community. As well as that, it may well mean that HIV notifications during this period fall quite dramatically. Sex work, I think, as sex work generally involves very close contact, I think it's important that, we know sex workers have been discouraged, the brothels have been closed because they do involve close physical contact. And I think a lot of the independent workers have stopped working as well. Their businesses shut down. There are some sites, including the Scarlet Alliance and SWAP, who have some very good information available. They're both metropolitan based, but also regionally based and relevant as well. So I think we're running a bit late, so I might leave it there and let anyone ask any questions if they want. Happy to.
Thanks so much. There's also further information on those topics in the earlier forum we did as well, if people want to listen to that in more detail. We're going to take a short break from the more serious content now for Timberlina to entertain us. We've got a fabulous drag entertainer who's also been doing regular performances every Saturday night, and so is down with the Twitch and Zoom. I'm a technical dunce, so I'm not down with the online performances, but Timberlina is, so please make her very welcome. Take it away.
To be without the simple things, so afraid my friends would see guilt in me. So I got a good job in the city, fighting for the man every night and day. I never lost 1 minute of sleep, worrying about the way that things might have been. I was the devil with the blue dress, blue dress. I was the devil with the blue dress on. I was a hoe, sugar pie, honey bun. You know that I love you, love you. I can't help myself. I love you and nobody else. Oh yeah, wait a minute, Mr. Postman. Wait, Mr. Postman. Mr. Postman, look at me. Oh yeah, please, Mr. Postman. Deliver the letter, the sooner the better. She wore a nitty bitty teeny yellow polka dot bikini. Stop in the name of love. But my mama told me you better shop around. Enough, baby, because I needed cash. I needed money, 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 money. I Mr. Big Stuff. Who do you think you are, Mr. Big Stuff? You're never gonna get my love, but he did. He got my coat, he got my love, he got my cousin pregnant. And when I tried to throw him out, baby, you know what he did? He whipped out this great big shotgun. Shoot a lorry, run now. Do the dirt, baby. Do the dirt now. Hey, I had nowhere to run to, baby. Nowhere to hide. I had nowhere to run to, baby. I didn't have nowhere to hide. Nothing you can say can tear me away from my God. My God. Nothing you can do, 'cause I'm stuck like hell to my God. Well, he may not be a movie star, but when it comes to being happy, we are. There's not a man today who can take me away from my God. Why you say? There's not a man today who can take me away from. I love him, I love him, I love him, I love him, I love him. Woo! I will follow him wherever he may go. There isn't an ocean too deep, a mountain so high you can keep me away from his love. Why? We are family. I got all my sisters with me. We are family. Get up, everybody, sing. We are family. Hey, I got all my sisters with me. We are family. Get up, everybody, get up, everybody, get up, everybody, and sing.
Oh my God, that was amazing. Thank you so much. Oh my God, what a finish. Please, there have been many requests in the chat for you to post your socials, Timberlina, and also links to the live streams you've been doing on the weekend. So make sure you hop into the chat and promote that to the audience. You were very, very well loved. We want to know where you got your dress from. I know we're running out of time, but this is a really important question.
From a second-hand shop in Newcastle.
God, it's so good. It's so good. All right. Well, I hope that that's woken you all up, and now we can get back to it. I'm going to welcome Dr. Emmanual Vlahakis, who is a sexual health specialist working for North Coast Sexual Health Services. He's passionate about access to medical affirmation services and making them affordable and accessible. And he's a member of OSPATH, where he serves on their education subcommittee. Emmanuel's here to discuss the relationship between COVID-19 and gender affirming care. Emmanuel.
Thank you very much for that nice introduction. I'm also in Bundjalung country up in northern New South Wales, and I pay my respects to elders past, present and emerging. I think the era of COVID has really just amplified the issues that are already existing in regional areas for the trans community, and that is really just access to social groups, access to medical services, and that's the whole broad range of medical services. For example, hormone prescribing, trans-friendly GP services, and then beyond that into the sort of the even more unusual or harder to find things like affordable surgery, speech pathology. I noticed somebody from Dress for Success. That was a great initiative when I was working in Sydney, helping trans people to get a wardrobe which is in their affirming gender. We have nothing like that up here. To give you an example, here in the North Coast, I cover the mid-North Coast, which is basically Port Macquarie to kind of Grafton, and then from Grafton to Tweed Heads, which is northern New South Wales. And really it's me providing 2 clinics a month, one for the south and one for the north. I mean, obviously that's not enough. We don't know, are there any affirming GPs who are happy to take on prescribing? So really it's access to service, access to service, access to service. And I know, as Teddy likes to say, and I believe that hormone therapy is life-saving therapy. So it's not cosmetic, it's not elective. So it really needs to be prioritised so that people in the regions have as good access as anybody else, and hopefully we can raise that access for everybody. The other issue, of course, is the socialising. So people in regional areas have to cover large distances. The numbers are small. They're likely to be facing stigma and discrimination. But having said that, they usually are quite online savvy because they've relied up until now on online chats and forums, and so very well connected in the online world. And I guess those of us who weren't so well connected have now learned to become more well connected. I mean, that's a double-edged sword. It means that, for example, we're largely running telehealth services at the moment, and that's a real, for somebody like myself who's really used to face-to-face consultations, it's really hard to kind of get used to meeting someone online in a medical capacity, meeting someone online and getting their history and prescribing, and maybe not meeting that person for the foreseeable future. I mean, it's something that a lot of doctors and clinicians are not really used to. Having said that, it saves patient travel, it saves having to pay money for, erratic public transport services. And I suspect that this aspect of COVID has really been an improvement. I know it was mentioned earlier, and telehealth in various forms is here to stay. It's not always smooth sailing. For example, I came across somebody yesterday who has significant voice dysphoria, and for them, having a telehealth consultation was very confronting, and they wanted to avoid it. So, it's kind of swings and roundabouts. Largely, I think it's going to be a good thing. It's going to mean that people who will not have physical access to services will be able to dial into somebody who will now be much more skilled in providing those services. Let's not forget the lack of Medicare item and billing for trans services. Surgery is appalling. There's very few providers of surgery in Australia, let alone publicly funded surgery, and that's just amplified in the regions because people often have to travel large distances, stay overnight, find accommodation just to see the specialist who will then, and end up being several $1,000s out of pocket. Further to the online thing, I just wanted to sort of say that the Trans Hub initiative that ACON have recently launched, I think a month or so ago, is really fantastic. If you haven't been on it, please go and have a look. It provides support for trans people themselves, for clinicians. There are links to lots of resources. It's somewhere to go if you're not feeling safe. It really is a wonderful initiative, and I know it took a lot of time, and I just want to congratulate all of those people that were involved. I guess the other thing about regional services is that it's so patchy. So, we have these now limited services on the North Coast. I know it's a bit of a postcode lottery. So if you just happen to live in an area where somebody is interested in providing gender-affirming treatment, usually they'll champion that. And so it's like a postcode lottery. You'll be lucky enough to be able to access those services. Hopefully telehealth will, again, mean that people from outside of those services can access care. I think that's really all I wanted to say, unless there were anything specific somebody wanted me to address. But I think there have been some wins with the COVID in terms of expanding the telehealth, but I think really the availability of services in the region is appalling, virtually non-existent, and we really need to work hard to champion the provision of those services, whether that be in the community through upskilling GPs and through mentoring new prescribers, or yeah, I think that's probably the best way to do it,
Right.
because it means that there are more GPs who are in more areas who can see more people.
All right, well, thank you so much. If further questions come up on the chat, we can pop them in at the end. I'm next going to ask Carly McDonald to speak to you. Carly is the Youth Care Coordinator and in charge of community engagement at Headspace Bega. Carly, what can you tell us about the impact of COVID-19 on youth mental health?
Yeah, thank you, Maeve. So yes, I am the Youth Care Coordinator and Community Engagement Worker at Headspace Bega, and I see in the chat there's a few people from Headspace with us today. For people who don't know, Headspace is a mental health service for young people aged 12 to 25. So the impact on youth mental health, well, 2020, what a year, what a lifetime. During this pandemic, Headspace is still providing a full service for our youth, albeit in the virtual world, providing support through video and phone services. So phone sessions appear to be more common, and this is mainly due to young people having more privacy, so they're able to leave their homes to have their one-on-one sessions. When social distancing rules were enforced, Headspace across the board actually saw a decrease in the uptake of services. This produced, initial concerns, but everyone was kind of aware everything happened so fast and people were probably hunkering down. So now most Headspace centres have now returned to normal levels of engagement, similar to previous years. Youth groups have been shifted to an online space, similar to this one. It's interesting to note, I've chatted to a few other Headspace centres, that Rainbow youth groups are seeing a decrease in attendance. Here at Bega Headspace, we've only run one online Rainbow youth group at this stage, but we've noticed a significant decrease in attendance, down to 8 from the usual 20 plus. So, however, like Sarah was discussing, we're kind of trying to see the positives in this, and we're attempting to use this online space as an opportunity to widen our reach. So the goal to engage more LGBTI plus youth who cannot attend the centre for various reasons. And one of the main reasons where I live is transport issues. So if this online space does become more accessible for LGBTI plus youth, then we may end up continuing online youth groups in conjunction with face-to-face groups. Headspace community engagement is now primarily through social media, something that I avoided for a long time and then now had to embrace. Headspace National is constantly coming out with relevant material, and they're constantly in communication with us. So getting feedback from, youth reference groups, Headspace workers, from what people are seeing on the ground. So they're currently in the works creating a resource, mental health tips for coming out of social distancing restrictions. So as, many people have concerns that there will be heightened levels of anxiety in young people as we begin to ease restrictions. So there are a range of mental health impacts that service providers are seeing with young people. Must keep in mind that before this pandemic, a disproportionate number of LGBTI plus youth already experienced poorer health outcomes. So this could just be essentially another layer. So common themes that service providers are seeing is an intensification in pre-existing anxiety, exacerbated by isolation, limits on physical contact with support people, friends and family. A lot of stress around online study and schooling, stress around loss of employment, particularly in our area in hospitality, increase in alcohol and drug use. A big one that we're keeping an eye on is family conflict. So a lot of young people are now confined within their family carers' household. This is a specific concern for LGBTI plus youth, particularly if the family is not supportive of the queer community. And the young person's, support groups are outside of the family domain with peers and services. So this can have a particular impact, for young people coming out. So as most of us in this space probably know, coming out is often just as much a process for family members as it is for the individual. And family members often need separate time and space to process their own feelings and reactions, and these kind of social restrictions are not really providing the space for that. On the flip side, though, we have seen a couple of positives. A couple of young people that I work with as well are pretty stoked at the moment that their income has doubled, and a lot of them are accessing JobKeeper. But we will be keeping an eye on this as when September rolls around to see what happens in that space. And some young people are actually having reduced anxiety. And this is mainly due to being able to avoid places such as school, where bullying, etc. occurs. But as I said previously, we'll be watching that space as well as social restrictions start to ease. I also wanted to flag, I know this is a COVID-19 panel, but I also wanted to flag that here in the Bega Valley and other areas in Australia, we are facing an unprecedented, that word's been used too many times, but we're facing an unprecedented time. So I have to remember that we just came off the back of a bushfire crisis, and in many areas in Australia, but in the Bega Valley specifically, in my experience, when COVID-19 began to loom, fires were still burning. I know down here we were consulting with youth reference groups, local schools and community members, how we could best support young people who have been impacted and were still being impacted by the fires, which essentially is everyone in our area to varying degrees. Just to put that in perspective, here in Bega, within our Rainbow Youth Group, we had 2 members who had lost their homes, and almost half our members were being constantly evacuated from their homes during this time. So we kind of hit the ground running. We'd begun implementing youth bushfire recovery programs, and the feedback that we received from young people was about community connection and specifically social connection in physical spaces. So local council, mental health workers, other providers began, hastily organising festivals, support systems, community groups. And, there was probably a lot of adrenaline pumping within the community at that stage. And we all, like I said, hit the ground running. Rainbow Wave Festival, which is our rural pride event, got shifted from Feb till May. Our committee members were all super passionate. We're going to make it bigger and better, have the RFS in the parade, kind of a lot of momentum. So before a lot of these programs could take place, the restrictions kind of came in and everything kind of came to a halt. And, there was like a sense of, defeat in this area. But, Headspace Bega is advocating strongly to Headspace National about this situation that we in other places find ourselves in, and our strong concerns regarding local youth and their families during this time. Headspace National and other youth mental health organisations are in constant communication with the federal government during this pandemic, advocating around continuation of subsidised MBS telehealth items beyond September, and real-time suicide surveillance, so services could more appropriately respond and prevent, contagion. So I guess to kind of sum up, this is by far a strange time, and we're all feeling it, in different ways. But how this will impact our youth cannot be fully known at this point in time. So it is an extremely dynamic situation. I know that dynamic word's been used quite a lot this year, but it will require constant monitoring, feedback and action so we can continue to provide our young people with the support that they require during this time. Thank you.
Thanks so much. We're going to have another one of our interludes, and I'm very excited about our next guest, Jax Lopez, who's a songwriter and cabaret performer, who'll be providing a little entertainment for us before we get to our final speakers. Jax, take it away. Hi, have we got you?
Can you hear me?
I can hear you.
I just had to add that there's a bushfire relief fund, which I've myself applied for. I don't know if people know about that. I just tried to find the number at the last minute, but I couldn't find it. But it's for people who were out of work. Carly, you probably already know about it due to the bushfires.
Yes, thank you. I'll try and find it and send through the link. Thanks, Jax.
I'm going to play my new song, Little Red. It's about recovering from trauma. Once upon
time I read about a child and he was a child in the woods. The trees sing uneasy melodies. They whisper when not your enemies, so don't go home. You're safe here in these woods. When the furry tale is over, I'm still gonna be stuck with me. When the danger has faded, I've still got an enemy. But when the battle gets real, I'm still gonna be here. When the nightmare is over, I'm still gonna wake up with once upon a time I read about a child and he was a child in the woods. No trees sing uneasy melodies. They whisper when not your enemies, so don't go home. You're safe here with us. No, don't go home. Don't go home. Little red, 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 little red. How many times were you told to smile when you wanted to run? How many times were you told to smile when you wanted to run? How many times were you told to smile when you wanted to run? How many times were you told to smile when you wanted to run?
Thank you, everyone.
Thank you so much. Similarly, I'd love you to post your socials into the chat for everybody who's been talking about your absolutely gorgeous voice. So thank you for sharing that with us.
Thank you, Maeve. Thank you, everyone.
Yeah. All right. Let's keep things moving along. Next, we've got Jenna Roberts joining us, who's the Director of Wagga Wagga Family Support Service and Deputy Commissioner with the New South Wales Mental Health Commission. We've heard from Carly about youth mental health, but Jenna, we'd love you to talk to us about the impact of COVID-19 on adult mental health and the sort of coping strategies we could all employ and services that are available to us. Jenna.
Thank you so much. And I would just like to thank all of the other speakers. We've had some really excellent information and also some beautiful performances. Today I'm wearing my Mental Health Commission hat, so just so that you know where the information's coming from. And I think given the amount of facts and information we've received, I'd really just like to focus on the supports that are out there for people at the moment. They're very similar for young people, the issues and the concerns that are coming up around telehealth and access to services. I was on a video conference with ACON this morning, and they're actually saying that anecdotally the trans and gender diverse communities are reporting that overall they are actually preferring to telehealth options because they are getting better access regionally than they normally would in rural and regional communities. So I guess that is one positive to take out of it. To normalise things, at least 45% of adults will experience a mental health issue at some point in their lifetime. So this isn't something that some people should be afraid or ashamed of. This is something that may come for about half the people that are on here today. And we know that LGBTI people experience this at a higher rate. So during COVID, I guess for myself as well included, there is just so much information out there. There's almost every morning there's the Premier or the Prime Minister or somebody around health or mental health having a press conference. So one of the tips and tricks is choose when you want to access your information. So pick one time a day, and you can be guaranteed that after every press conference, there's usually a little meme or memo that highlights the top 5 points. Sometimes it's better to stick to them than listen to the hour or the hour and a half press conference. So try and use your social media definitely to connect with family and friends and access supports, but choose when you are accessing COVID information and try and limit it if you can, so that you're not being overloaded with that. Almost all social media platforms now have an option where you can choose to see COVID information or not. So that's also a really great tip or trick, so that you may only choose that you see it on one of your social media platforms or on none of them, and you can Google it at your own choice. These things I'm going to say, I guess, are pretty standard for issues around mental health. So trying to maintain a routine and stay and eat healthily and exercise are all things that will help keep your mental health on track. These are really simple tips and tricks, and sometimes it's just as easy for people if you're struggling to get up and have a shower. If that is your one thing that day that you can do for yourself in your self-care, then by all means, please try and do that. For other people, self-care means, all different sorts of things. Might be listening to some music like we just did, which was absolutely beautiful. But now is the time to practice your self-care strategies, which might be reading a book, taking time out. Self-care strategies are as individual as we all are on here today. But making sure that you're taking time for yourself, particularly if you're a carer of somebody who has a lived experience or is experiencing mental health or drug and alcohol issues, it's really important that you take your own time as well to look after yourself. The age old, you can't pour from an empty cup. This is really a time right now to be making sure that you're filling your cup up as much as you can so that you can look after yourself and your loved ones. There's as much information out there, there is support. So we are going to post on here and also send out afterwards a range of different support services. My biggest piece of advice is, if at first you don't succeed, try again. So we've heard a whole range of different bits. Some people I speak to say, look, Lifeline's the way to go. They've given me great support. Other people would prefer something like Q Life or suicide callback service. You've got to find the one that's right for you. Something that's also really interesting that I like to point out is that Lifeline is not just for people who are in distress. It can also be for family, friends, work colleagues. If you're noticing a change in behaviour of somebody, but you want to speak to an expert to make sure that you know what to do or get the right piece of advice, Lifeline provides that service. And they also have an up-to-date list of services in your area that can help, when face-to-face services are available. So you can ring up and say, I live in Wagga Wagga, I'm really worried about my friend. Here are the changes in their behaviour. Can you please give me some advice? So Lifeline is there for that as well. How do you know that somebody is struggling? I guess there are some general things to keep an eye out for. Their appetite might change. So they might stop eating or start overeating. Their sleep patterns might change as well. There may be somebody who usually reaches out daily and all of a sudden they're withdrawing, or the opposite may occur, that you may never hear from them, but they're reaching out more. And also you may notice that people are turning more to drugs and alcohol, and particularly because pubs are closed, so people are now getting alcohol. You can get delivered to your door, so it's much more accessible, and it's much more private at the moment. So it's not people aren't picking up on alcohol abuse as much as they would be if they're at a pub, and people can say you're cut off, you need to go home. Well, you're already at home and you can get more and more delivered. So these are just some signs to look out for in your loved ones and even in yourself. But please note that there are a whole range of services and supports out there. But something that I did want to pick up on is that regionally we know that in some areas in rural and regional New South Wales in particular, there are places where up to 35% of households do not have access to the internet. So that's something to really keep in mind for the service providers who are on here, that as easy as it is to say, we have telehealth options, or, this is available, some services just simply don't have access to internet in their own home, which means that a video conference call is just out of the question. So we need to be creative. We need to meet people where they're at. But the main thing is, I guess, given all the stats and everything, I think that first presentation from Kat was really interesting about COVID itself. But I just want to reiterate that there is support available for people who are experiencing distress at the moment, and also people who love and care for people experiencing distress. Regionally, we know that there is often a lack of services as it is, but what we are hearing at the Commission is that the fact that there are now more choices, and that more telehealth choices and access to GPs you can now do via telehealth, that more people are reaching out for help in different ways than they weren't before. In my other day job, we're actually experiencing more people accessing our parenting groups, because they can do it online and they don't actually have to sit in the same room as somebody and speak about their kids or speak about the issues that they're having parenting. So there are some real positives, I guess, for services to learn from, and to know that, potentially there won't, normal is, I don't believe in normal, but normal is, I don't think, a setting that we'll ever go back to. So please keep an eye out for your friends and family and people on your social media. Please have access to these helplines. You can save them in your notes. I've always got them in my notes in case I see somebody post something, I can quickly send it out. But the main thing is that there's hope, and that this will come to an end, and that really my main point today is, the fact that we're all here is a show that we are resilient, and that I think we'll all look back on 2020 and almost be glad it's over, but I think we will become much more resilient human beings, and know that have friends and family that we know that we've been there to support.
Thanks so much. We've got our final guests now, Simone Jordan and Lyndon Rowland. Simone is a community relations team leader at Awabakal, and Lyndon Rowland is an Aboriginal health practitioner at Awabakal Medical. Lyndon is both Wiradjuri and Thursday Islander born and was raised on Awabakal country. Simone and Lyndon are here to discuss the impact of the pandemic and lockdown on Indigenous communities.
Yeah.
Got you? Hi.
Hi, everyone.
Hi.
We will also just do a quick acknowledgement to country and elders past and present, and congratulate you all on a great afternoon of information. It's been really awesome to sit here and listen to what other people are doing. I'm just going to give you a bit of an overview of how we have been working through our issues at Awabakal. So we cover a very large footprint. We look at services from as far down as Manning Point, Dora Creek, almost to the Central Coast, and as far up as Karua community, and as far out west as probably Cessnock and Singleton. So we don't get to all those communities for our outreach, but we do offer available services to those communities. We have 4 medical clinics and 2 preschools. This all happened in the process of us moving into a new building and transitioning all our services into one location. That was fun. So everyone then went to ground and worked from home. I have still been working in the office because there's enough room for us to have 4 or 5 people in our building at Wickham, and help to provide basically the social messages and the support programs to the community, utilising our staff that we could to do deliveries and services that we could still provide online. In short, we offered phone consultations for our health services. Telehealth is now set up as well. For our aged care services and our NDIS services, we had to cut back a lot of the social support stuff, but still maintained our wound care and home visits where possible, once we could get our hands on the right protective equipment, and once we could have people make a decision whether they actually wanted someone to come into their home, which was also their option. So we've managed to keep the majority of our services going. We did have a question about access to our NDIS for people with disabilities. We do have a referral process for that, but if you go onto our website, there's a contact button where you can contact us and we'll send out the information to you, or indirectly email me and I'll put my details on and provide that to any services that are after that. So we have transport services for our clients, whether they're elders, aged care, NDIS, or our clinics once they go back to face-to-face. So we have the provision of transport to those people. We have people that can go out and do home visits to those clients as well. We did set up a 1-800 line as well, because we know there's a few issues in our communities that we knew would be a problem. One, our people live in overcrowded homes, and it was very hard on some people to be not frightened of not being able to social distance appropriately. Sometimes 2 and 3 generations in a 2 or 3 bedroom home, and we had to provide support around safe measures for that. The 1-800 line was more for people who were feeling the effects of loneliness and needed to contact someone for financial support or emotional support during the initial stages of people getting used to being at home, I suppose. And we actually had that running for 3 or 4 weeks, and then the calls dropped right back. So we've just cancelled that. We did that in partnership with AusPsych, who were amazing. And we're now just taking referrals off our webpage and trying to address those individually. So we have had a few strong messages come out in regards to hygiene, more so around our families. We're used to being with our families. So I suppose to not be with your family on Mother's Day, or, you know, you mob around those sort of social occasions, was a very difficult message for us to instill. And people thought that it was still okay because it was just family, you know, like, but in saying that, it can be 20 people in one room. So we had to really drive those messages home during our consultations and our visits to people as well, if we've seen that sort of happening. So we utilised our staff however we could to provide support to our elders. That included initial hygiene packs and care packs being dropped at their doors. We had a team of transport drivers who we used to get people to appointments that were desperately looking for work and hours they're only casual. So we utilised those in partnership with our chemists, and our GPs were faxing scripts directly to our partnering chemists, and then we'd deliver those to the door of the people who needed them. That included care packs and hygiene packs and any equipment we could get our hands on to make them feel better. We also had to close our dental services, and a couple of our mental health services stayed open. They actually did telehealth and online consultations, and have been really great to work with as far as feeding back the social feelings of what's going on in our communities, and then enabling us to try and put programs in place to address that. The one other thing that I also wanted to mention was that we did start a home delivery food program for our elders. We used a place called what are they called? I can't remember it now, and they're going to kill me for that. Oh, Fast Fuel Meals, sorry. Who then approached us because we were getting like 500 meals out to our elders. So basically 2 meals a week. We have 250 clients on our aged care program. Our elders were lonely, not having that interaction. A lot of them don't have access to technology. So we decided to engage them to deliver the meals to us, and then we used our existing staff that were running low on hours, casual staff, drivers, to deliver those and do welfare checks. We also had our staff doing phone calls like to our clients identified with chronic illness and mental health issues, just to do, you know, a check-in each week. So we found that there's a certain element of people who really thrive on the social media side of using our services, like you guys, who don't want to be sitting in waiting rooms, who are shy, particularly those with mental illness and, you know, chronic disease, who don't like to be the same sitting in a waiting room, sort of feeling like they're on show, having a cough, or with their diabetes issues on show, or, you know, so that sort of stuff's been interesting for us too, and we're going to look at how we can include that in our business as usual. We also had a chat line everyday live. So our PR company, which is Head Jam in Newcastle, had a half an hour a day where people could ask us questions, and then we had someone from our clinic with that person to try and provide that information. The other thing we addressed was basically sexual health, providing condoms and all those sort of things for people who we knew needed them. We have a few hostels where they're still locked in, but there's still access to do those kind of things. We know it's going to happen, particularly with young kids and in our community that are doing that. And we also tried to provide information around smoking, and particularly with our community and the LGBTQ community, it's like quite a high number. I think one of the things we tried to drive home was, yes, we have the NRT available. So we've used our transport drivers again to provide free NRT for people, but also sharing smoking utensils. We know bongs and cigarettes are shared in our communities. People pick up bumpers off the ground, those sort of things. And not many people are comfortable to talk about that on their social media pages, but because we know it's part of our community issues, we'll just had to be open about that sort of thing and provide those messages. So the other thing we did was start a podcast, but we haven't been able to launch that yet. And we're looking at doing things like that in the future, depending on how long this goes on for. And I know they're easing restrictions, but just to reach a wider audience and provide, I guess, information and a bit of lighthearted entertainment around some of the serious stuff and the messages that we're trying to get out. So we've actually been using Owen Craigie for that, who's a big advocate for mental health and very open about his stories with drugs, alcohol and suicide. So he's been really helpful during this time. I'm trying to think of anything else. I did have notes. I've got notes here, but I'm sort of rambling. Oh, our maternal health team is just starting now to do home visits again. And we're looking at ways we can try and do immunisations in a safe way around families, because it's not something, we don't want people bringing their babies into clinics where there's other issues in the environment, but those sort of things. And we love the fact that we can work with you guys in partnership like this and address things together, and listening to some other people talk about the strategies they're using is really reiterating some of the feedback we're getting about, yes, there are different ways to deliver things. And we've never been encouraged to work from home or openly use these kind of forums, I suppose, in the past, but we're in a position now where we have to, and it's sort of a bit of a slap in the face for the government agencies that stopped us doing that for so long, and now providing this stuff a different way. And I take my hat off to everyone, because I know how inventive we've had to be to engage with people and get those messages home. So we'll send through our website contact for anyone who wants to contact about the NDIS stuff, and I'll also put my personal email. We're really the first point of contact for anyone wanting referrals. So we look forward to hopefully celebrating Reconciliation Week and NAIDOC in whatever way we can with you guys in the future, and sharing this information and being in this environment really helps us to address our clients that come to us with those issues. So Lyndon is in a clinical role. Did you want to have a chat about what you do just through the testing?
Yeah, so with me and the other health practitioners, we go out every day to do swabbings. So you do the home visit. So where there's not really like bookings. So like tomorrow, I'm not going to know how many bookings I have. So it's just every day, like the doctors get a phone call and then we just have to like go back and forth. But it's good. So we go everywhere, like up to Krua, out to like Kurri, like Cessnock, and down to probably just the start of Central Coast to do all these swabbings to get them back so people can have that confirmation if they have COVID or not.
With our communities being very susceptible to anything in this kind of, or anything respiratory really, we've probably got a 1 in 6 high chance of our older people catching it. We haven't had a lot of feedback about kids being sick, but we have had a few elders in our community who have been sick. There's not a lot that we can do other than just try and support the rest of the family around how to care for those people and direct them through the existing services that are there. But it's providing that information to the rest of the community, I suppose, on what works and what doesn't in that environment, and being able to get out and do a little bit of outreach, even though it's different to what we were doing before, is again just giving us that connection. And yeah, we're just finding people are just so happy to see someone now, particularly like even when we were dropping the meals off, we're just dropping them at the door, but people were chasing us up the driveway for a talk. So, but anyway, thank you for having us today.
Thank you.
And we look forward to celebrating, and the entertainment's awesome. Thank you, guys.
Thank you.
Thank you. We have come to the end and run out of time. So thank you on my behalf to everyone who spoke today and to all of you for joining us. Sarah, did you want to wrap things up on behalf of ACON?
Sure, will do. There's been some great questions in the chat. We're going to capture those and make sure we share resources with people who have attended, registered with us, as well as across our social media. I think I'd just highlight that I think regional New South Wales, as people have said, have gone through such hard times lately. What a resilient lot everyone is. And I think ACON and everyone else is just looking forward to coming back to the times that we can have those wonderful Pride and Mardi Gras events that have been spreading throughout regional New South Wales, and getting to see our peers once more. So thank you very much for joining, and please stay safe and well.
Thank you so much. We'll see you then.
Thanks, everyone.